I am also testifying on the bill that I'm very proud to file with Representative Lindsay Sabadosa and Representative Denise Garlick, Senate 766, House 1267, an act establishing Medicare for all in Massachusetts. And, Representative Sabadosa did a terrific job of highlighting exactly what the bill does and the fact that we have spent a lot of time, including a lot of advocates, updating the bill and hopefully making it more relevant to how do we move towards making a healthcare right in Massachusetts. So I really appreciate her work on that. And I would just say that, I think it's important for us all to step back right now with the pandemic mostly behind us and thinking about what happened with the pandemic in healthcare. And just a few quick points is, first of all, at the beginning of the pandemic, with many businesses closing down or having to lay people off, all of our offices had to help our many constituents move from having employer-based health insurance to often Mass Health or the connector. Think about all the inefficiencies in that. Think about the fears and concerns that so many of our constituents had when they were in transition about what kind of health care they had. The Medicare for All bill is looking to move beyond that, is to say that healthcare should not be tied to your employer, should not be employer-based, but it should be a right. It should be something you have from cradle to the grave. And so, that's one perspective to think about. Healthcare costs. We know that healthcare costs continue to go up, and despite the excellent efforts of this committee, many other efforts at the legislative level to reduce healthcare costs, Massachusetts has the highest healthcare costs of any state in the country, and we have the most expensive healthcare costs in the world. And what I would submit to you, Mr. Chair, and to you, Madam Chair, is that the changes around the edges around healthcare costs are not, in my opinion, going to significantly reduce healthcare costs. The only way is to dramatically change the system, and that's to get away from profit being in the health insurance or healthcare system and to provide it as direct government reimbursement to our wonderful doctors, nurses, and other healthcare professionals in Massachusetts. And the third point, which really sort of highlights that cost, is that the House and Senate is engaged right now in reviewing the spending of ARPA funds. The House proposal spends over $750 million on healthcare. I assume the Senate bill will in a similar fashion. Think about the fact that there's so many gaps in our healthcare system, whether pandemic related or right now, whether it's mental health care, whether it's primary care, whether it's some of the gaps in our urban communities or rural communities or people that are less well off. So if we're having to spend so much state money, why not move to a system where everybody has health care guaranteed as a right? So those are the things I just ask for the chairs and the committee members to think about. We have a tremendous group of advocates that will be testifying today, obviously people telling their stories. I want to give a special shout out to Mass Care, to Western Mass for Medicare for All, and the Mass Nurses Association that have really been at the forefront of arguing for making healthcare right. What better state to make healthcare right than Massachusetts? We've made incredible advances around coverage over the past 20 years, but I do think it's time to have that conversation about making healthcare right. And I think the revised and updated bill that we've done is the right path. So thanks so much for taking me out of turn. Really proud to file this with Representative Sabadosa and Representative Garlick, who put a tremendous amount of thought into this bill and advocacy for today. Thank you so much, Mr. Chair.